Employer-sponsored health insurance is growing costlier in the U.S. New data from the Kaiser Family Foundation finds the average annual premium for employer-sponsored health insurance for individual coverage and for family coverage was up 7% each over the last year. Workers are contributing a greater amount to premiums, too. Here to break down the rising costs is Eric Calciano, Health Benefits Advisor at New City Insurance. Eric, give us a status update on the cost.
We're seeing the biggest increase in about a decade right now. So we're seeing a 7% increase for health insurance across the board. This is according to the Kaiser Family Foundation annual survey that they put out. And we're seeing that the cost for individual coverage, annual cost for individual coverage is now at $8,400, and the cost for family coverage is all the way up to $24,000.
Goodness. Why the rise?
There are a variety of factors that are contributing to this that are all hitting at once. That's why we're seeing such a large increase compared to previous years. One of them is one that I'm sure you've been hearing all over the place when it comes to any market, but inflation. And inflation hit health insurance later than it hit other industries because the way that health insurance works is the health insurers that you're used to, the Blues, United, Cigna, Aetna, they contract with medical providers and they have multiple year contracts. So while other industries were experiencing inflation, prices were locked in for medical care until those contracts came up for renewal. Now we're seeing a lot more of those come up for renewal, and the hospitals and medical providers are demanding higher payments, and that gets passed along ultimately to the consumer. So that's one component. Another component is employment, staffing shortages for hospitals. We're seeing that it's becoming much harder for hospitals to staff, and that increases labor costs. We've seen an increase in specialty drugs. Specifically, one of the big places where we're seeing that is weight loss drugs like Wegovy and Ozempic are having a huge increase in demand, and that is going to increase costs. Everybody shares in those costs because we're in an insurance pool together. And also the last piece that we're seeing is pent-up demand for care that was put off during the pandemic.
Wow. I'm speaking with Eric Calciano, Health Benefits Advisor at New City Insurance, and we're talking about how employer-sponsored health care costs keep rising. So you referenced that pent-up demand. I mean, part of this, too, I guess, is that once it gets to a certain expense level, right, we as consumers might delay health care coverage, might skip it altogether, right? I mean, that can compound things, obviously.
Absolutely. Yeah. Well, because what we've seen is we have increased the amount of insured individuals around the country. So we have our lowest uninsured rate that we've ever had down to about 8%, which is good. But the problem with that, if you dig deeper into those numbers, is that many of the individuals, even when they are insured, they put off essential health care due to higher deductibles, higher copays, and out-of-pocket maximums. So while they're technically insured, they're functionally uninsured due to these plans just eroding the quality of coverage, eroding the amount of basically increasing deductibles and costs overall. So individuals just can't afford to access the care that they need.
Jeez, I mean, is there such thing as a proper balance when it comes to health insurance, or is this it?
You know, we're gonna have to see where it all ends up, but where we do see the positive side of healthcare is we've got about 54% of individuals who have coverage through an employer-sponsored health plan. Employer-sponsored health plans, while we are seeing the costs go up, there are many employers that are taking on new strategies to help reduce the costs of healthcare, to source care at a lower cost and still allow strong access to care for their employees. So I think that's where we're going to see one of the biggest changes in this industry is when businesses just say we're not going to keep with the status quo. We're going to start operating health plans in a different way that's going to function, because right now the trend right now is not going to work for the long term.
Thanks, Eric. Eric Calciano, Health Benefits Advisor at New City Insurance.